Living in a rural area can be wonderful. However, accessing your health and social care in this environment can also be challenging. Did you know that Hywel Dda Health Board are increasingly developing services to help rural residents access their care closer to home whenever possible? Care online encompasses a range of different services, including linking staff and patients from local hospitals to specialist services in South Wales, linking health professionals to patients in their own homes, as well as the use of apps or online information to better support you in your own community. In this short film, we explain how care online could be useful for you or your family.
One of the problems that we have in a rural area is bringing patients and specialists together. Either patients travel substantial distances to see the expert, or the expert travels substantial distances to see the patients. Obviously that consumes patient time, and if patients are unwell it may be difficult for them to travel. They may require transport from family or carers, which adds to the difficulty of getting to appointments.
I use video conferencing many times a week. The majority of that is at multidisciplinary team meetings. We do this by video conferencing so that we can tap into expertise throughout Wales to ensure that people from a rural area receive the same level of care that they would receive at a cancer centre.
The iPads that we have at work are given to patients for a period of time, and I have an iPad at base. So that means that we can make contact with patients more regularly than maybe we would be able to if we had to drive to see them.
So one of the clinics that I run through telemedicine is in neurology. Periodically I meet with neurologists and we discuss cases of patients who might come to this hospital. So there is some support for me, and there's some local expertise for patients when they do come here, and better links with the specialist centres.
We would also be looking at the iPad to work using additional assisted technology with the use of apps.
I come across from the community mental health team, and they've kindly allowed me to use their equipment because we have a client in common. This lady lives so far away, I would have been able to see her only once a month in person. Now we're using the iPad, I'm able to contact her weekly and more often if there is a need.
Patients have said and fed back to us that they have felt empowered by not having to make the journey, being able to have that support and service from the comfort of their own home.
The introduction of the FaceTime service has been amazing. I live in a rural area 1 hour from Bronglais. This service has allowed me to communicate regularly with my art therapist, and it has enabled me to keep appointments that may have been missed due to my physical mobility problems and inability to travel.
It's the convenience of being able to just use it straight away without all the hassle of having to go into town, and the fact that I can gather my thoughts and have a few quiet moments and then be straight into it, rather than having to do all the driving and parking, especially as around the hospital it's not easy to park.
I think when somebody is facing a cancer diagnosis, there is the most agonising part of it is waiting. That's why it's important that by utilising the services locally here, they can be seen sooner, but also knowing that they are receiving the same advice and management as they would in the more specialised areas.
I've had patients of all different ages that are computer literate. As with anything, it's a tool. It's to be used appropriately with people, so it's gauging what's right for each patient on an individual basis.